from KUHAS, and there I teach biochemistry and molecular biology and some bioinformatics, but sometimes I teach epidemiology and biostatistics. So I hope all participants are from KUHAS, or I don't know, I can have the overview from the representative.
Some of them are from KUHAS and others are from other universities, for example, Kairuki, St. Joseph.
Okay. And all of them, they are medical students, isn't it? Particularly doing MD, isn't it?
Yeah, most of them.
Okay, perfect. So my presentation will be in a form of discussion. So anyone can chip in. You can raise hand, or even without raising hand, that is perfect. You can go on. You can post your question on chat if you are not able to communicate due to device issues, and then we can have a nice discussion. So move to next slide. Next slide. Okay. So this section that we call research methods is the most important section for the research proposal. When you are writing a proposal, most reviewers, when they want to give you fund, or they want to see that your research is robust and worthy, either for going on for elective or for masters or for PhD, or even for being awarded fund, they have to review that section thoroughly. It is the method which narrates how your research will be done. So it narrates explicitly how the research will be done. It has to be written very clearly, so as someone else can repeat your research without asking you or without asking the writer. So the key thing here is to write things very clearly. So as when somebody is about to repeat your work, there's no need to contact you for clarification. Everything should be stipulated there very clearly. This is the most critically reviewed part of the research proposal, as I've told you before, when they want to give you fund or whatever, or they want to appreciate, to cross-check what you did is robust and worth that finding that you are going to have, or is going to provide findings that they are scientifically sound. They review the research method. So it can be the longest part of the research proposal, because most of the things like introduction, problem statement, whatever, introduction is known, the topic is known, but your method will need it to be very, 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 very clearly written. So from there, those are 5 points regarding the methods. Before we go into the sections of that section, is there any question regarding to you? As I've told you, my presentation with you will be in a form of Q&A and much more of discussion. You are welcome. Okay, if no questions, we can proceed to next slide. So these material methods, it has subsections and it has several sections. And I think it is the most populated by subsections compared to other sections when you're writing a proposal. So in the research proposal, you have those things, and they should be narrated very clearly, but very brevity, with very short words, but very clear, short sentences, but very clear. Like study design is the first part. You need to tell your research you are going to do is of which study design. So you can just use very few words to say the research design is that one. Simple like that one. Like the research design is case control, or research design is cross-sectional study or cohort study, or randomized controlled trial. So you have to specify the research design with the title. And then you have to say the study setting. The study setting is where your study is being conducted. And the study setting will be at Bugando Medical Center, or the study setting will be at is it Hubert Kairuki Memorial Hospital, or the study setting is at Sokoine University. So specify the study setting. Bugando Medical Center in Mwanza, Tanzania. Or Bugando Medical Center, a tertiary referral hospital for Lake Zone in Mwanza, Tanzania. Or the study be done at Muhimbili National Hospital located in Dar es Salaam. That is the study setting. And then you have to specify with the heading study duration. Study duration is the time when your data will be collected. If you are collecting data from January to December of this year, then you can say the study duration was January 2025 to December 2025. Should be that stipulated very well, precisely, shortly, but clearly. So we know that this is the study duration. And then you have to specify the study population. These study populations are the people, the study population is the people, the group of people whom your data is going to be collected. You are doing your study in pregnant women, then that is the study population. Pregnant women, then you can specify under a particular condition like third trimester, or pregnant women aged, you can cut off the age more than 18 years, or the study can be done among medical students from all medical schools in Tanzania. So that is the population. So these are the people. And if you do like the comparison into your study, you can specify. Like in this study, we compared those who were smoking cigarette compared to those who are non-smokers. Or we compare the performance of UE exams among medical students and other students doing either law or engineering. So the comparable group should be stipulated clearly. And if it is a case control study, you have to define the cases as well as the control, depending on your study design. So from those 4S, study design, study setting, study duration, and the study population. Are there any issues to clarify or comments or even compliment or questions? I'll be glad to respond.
We have a hand from Daki.
Okay, Daki, go on.
Yes, my question is about the study design. May you elaborate a little bit? Maybe if there are some criteria in study design and some aspects related to study design, can relate a little more. Elaborate.
Okay, thank you so much for that question. Now, there are several study designs. In epidemiological studies, we have the following most popular study design. One is a cross-sectional study. We have case control study. We have cohort study, which also has branches. We have prospective cohort and retrospective cohort. And then we have randomized RCT, randomized clinical trial, and other studies. They can include ecological study, as well as there is another one that is scientific. I'll remember the name and I'll tell you. There's the other one that is called Quayas experiment. I've remembered it. It's Quayas experiment. But for us, the most common one are the first four. One is cross-sectional study. case control study, cohort study, and randomized clinical trials. However, doing randomized clinical trials, that is higher level study, and I've written them according to the improved evidence base. So the complicated studies, they are in that order. The simplest one are the cross-sectional studies. So most of us, even myself, sometimes most of the studies I'm doing, they are cross-section. And for you medical student, the most common study you're going to do is cross-section. The other type you can do is case control. You can also do cohort study. And to the advanced level, you can do randomized clinical trials. So I know at least you have some ideas on how these studies are, but simply the cross-sectional study is for determination of prevalence. You want to determine prevalence, whereby the magnitude of disease is assessed, you can do cross-sectional studies. And most of the students in the elective studies, they have done cross-sectional studies for determination of prevalence, and everything is measured at once. It can also determine the factors associated with, but the evidence from it is not that much robust. And then we have case control studies and cohort studies. These are suitable for determination of association between an outcome and an independent variable, or association between a factor and a condition like a disease. However, the cohort studies, they are also important for detection or determination of incidence. Incidence is the occurrence of disease per a particular time. And then you can do the randomized clinical trial, which is highly organized and a bit complicated studies. And for me, I've done very few RCT. And I'm not sure if there is a student in MD4, MD5 who even those doing master, they can do RCT. So those are higher level studies. But for them, they are good for detection of effectiveness of drugs, effectiveness of vaccine, effectiveness of particular systems and whatever. So those are the most important studies that can be done in the epidemiological studies. I'll be glad to have more questions regarding this one, so as I can continue clarifying. And I've told you before, my presentation will be more Q&A and discussion. I hope I've given you some details. If I'm giving too much, you can also let me know. But if I'm giving you too little, you can pop in so as I can give much details.
Yes, you have elaborated very clearly, but my
Okay.
concern was about the cohort, about the prospective and retrospective.
Yeah.
Yes, it's where my concern was. You have elaborated very nicely, but my major concern was about the cohort, both the prospective and retrospective, because I attended a certain conference and I saw people during their representation of their research. They'll say that we did a prospective study, and some were saying that we did a prospective study. So I was now asking myself, what are these kinds of? I think I'm clear.
Yeah. So let me narrate to you now. Cohort study is whereby cohort is the English word that means a group of people who share a common interest. Okay. So even this group we have this presentation today is also a cohort, whereby we are terms whatever research methodology calls cohort. So this is the cohort that we have. So cohort is a group of people whom are recruited for a particular study, and they are followed up for a particular time. So in prospective is you go ahead with the group, and in retrospective, you go back with the group. So in cohort, prospective, and even in retrospective, you must know your outcome. In most cases, it is a disease, and your factor associated with, which we call exposure. For instance, we want to understand if being exposed to alcohol can cause someone to get liver cirrhosis. Is that a common example, yeah? Alcohol and liver cirrhosis, isn't it? Or there are people who are not medical related.
I think
So-
in that
That's simple example to understand alcohol and liver cirrhosis.
yes, we can use that.
I can use that one. Okay, so you start with a group number one. You start with a group that they don't have your disease. In this case, the disease is what? Liver cirrhosis, isn't it? So you have to test people and be sure that all of them, they don't have the disease, which is liver cirrhosis. And in that population, some naturally, not forced or coerced or persuaded to take alcohol. So some will be exposed to alcohol and some are not exposed by their decision. You as a researcher, you don't have any influence for them to start taking alcohol or not taking alcohol. So you have a cohort, let's say of 500 people, then 200 will be not taking alcohol and the 300 are taking alcohol by their decision. But at the beginning of the study, all of them, they were free of the disease. No one had liver cirrhosis. And you follow up them for a particular time, or most cases years. Yeah, it can be even more than 5 years or 10 years. You follow up them for that time of period. That's why these studies, sometimes you cannot do as a student to complete your master's or PhD or your elective because you don't have time to follow up for 5 years or even 2 years. You don't have that time. So those researchers who are doing prospective cohort, they then follow up to see how the liver cirrhosis occurred between the two groups, those who were taking alcohol, and they also measure the occurrence of the disease in the group that was not taking alcohol compared to the group that was taking alcohol. The hypothesis is if alcohol is associated with the liver cirrhosis, there are going to be more cases in people who are taking alcohol than in those who are not taking alcohol. And then you do some calculation for either odds ratio or incidence rate or relative risk. And then you can make the p-value and you can conclude on whether there is association or there is no association. So that is prospective. You start with people who don't have the disease and you follow up them till some get the disease and some don't get the disease. That is prospective cohort. Okay, is that clear, that one?
Yes, it's clear.
Okay, then the retrospective is the opposite of this one because we don't have time for follow-up. Then we go to the scenario that has already happened. We go to people who have liver cirrhosis and to the people who don't have liver cirrhosis. And we go back asking them if they were taking alcohol or not taking alcohol. So the retrospective just uses very little time because you can finish it within a day. You wait for the situation to happen, and then you start with cases and non-cases, and you ask them now to see if they developed the disease, if they were using alcohol or not using alcohol. And then you have those groups, and then you can do the odds ratio, and you can calculate the incidence rate or the relative risk and determine the p-value for determination of association.
Thank you, Prof.
Okay, karibu. Asante. So you can find time to read the other study designs because that is the topic by itself. Epidemiological study designs. There are so many, and I've told you, you can have the narration in how to analyze data regarding those study design. You can do that at your own time because we cannot finish everything in 2 hours. But let us have the overview and generate interest to read so as you can continue gaining this knowledge at your own pace. So you can go to the next slide. So we have these study design, study setting, study duration, and the study population. Then you have to determine the sample size of your study participants. You are saying, okay, I'm going to take pregnant women. In this study, I'm going to take medical students, or I'm going to take people who have liver cirrhosis. Now you have to determine the sample size. So you have to calculate the sample size, and sample size is calculated. We calculate sample size by using formula. So for each study design, there are formulas, not formula. Sometimes there are formulas for calculation of sample size. We have formula for cross-sectional study, formula for case control, formula for cohort, formula for clinical trials, which has also types of clinical trials, and each type has a particular formula to calculate the sample size. So you get the sample size by using formula. For instance, in cross-sectional studies, which most of you are going to do it, we are using Kish-Leslie formula, whereby we consider prevalence and the other factors, precision in it, and then Z, there are those things for confidence. Then you determine your sample size. Now, let's say you want to do a study in medical schools in Tanzania, and your sample size is, let's say, 500. So the question is, how are you going to get your 500 medical students, whereby there are over 1,000 or even 5,000 medical students in Tanzania? So sampling procedure, it means how are you going to draw your sample in the presence of many study population? You have a lot of medical students, but for you, you want only 500. How do you get those 500? Are you going to take all of them from KUHAS? Are you going to take MD5, MD2, MD3, MD4? How are you going to get that sample size you have calculated? That is sampling procedure. And there are so many also procedures like random sampling. You can do probabilistic. You can do convenient sampling. So they are other mechanism for getting the sample size, so as we obtain representativeness. But random sampling has been the most commonly used. And then after narrating on how the sample size is going to be drawn or recruited, after it has been determined by the calculation, you need to specify the inclusion and the exclusion criteria. Inclusion criteria, you specify what exactly are the kind of people who are going to be into your study. And the exclusion, most people, they confuse exclusion. They think exclusion is the opposite of inclusion criteria. Somebody can say my study population is pregnant women, and the exclusion criteria is saying women who are not pregnant. That is very wrong. Exclusion is when somebody has been included and is therefore now being excluded. So a person or a participant is excluded after he or she has been included. If your inclusion criteria is pregnant women, therefore exclusion criteria should be pregnant women with something else that has made you to exclude that person. So you have to exclude after you have included a participant. If your inclusion criteria is medical students, then exclusion criteria should be medical students who are either foreigners, but they should be first medical students, and then find something else on top of being medical student that has made you to exclude. The most common exclusion criteria, I can say, if I'm doing study on pregnant women, I can say pregnant women who are seriously sick, they will be excluded. Or pregnant women who cannot communicate the local language, cannot communicate this local language, Kiswahili, then they are excluded. But they have first to fulfill the criteria of being included. and then you add something that made them to be or make them to be excluded. So that is it. So regarding this SSCI, sample size calculation, sampling procedure, and inclusion and exclusion criteria. Anything to clarify or question to respond or even comment? You can add also something, you can complement, because the things I'm discussing with you, they are not new. Karibu.
Good evening, sir. So my question
Evening.
is, first of all, we have to have a population, and from that population, then we have to generate a sample size, and then we have to recruit those participants. Say we have 500 participants, and then from those 500 participants is where we have to include some in the study, and we have to exclude some from the study, right?
Exactly.
Is that not going to give us less data, because we were expecting that from 500 people in the sample for them to give us data? Then if we're going to exclude, maybe we are remaining with 250. Isn't the data going to be a little?
Perfect. You are excluding as you go on with data collection, as you go on with recruitment. So you include. If you exclude someone, you have to replace. So at the end of the day, your 500 number is attained.
Okay, thank you.
Is that clear? It is an ongoing process. Let's say you enroll patient 1 is okay, patient 2, patient 3 is okay, 4 is okay, patient 5 is also pregnant women, but cannot communicate. So we are excluding that person, but we have to look for someone to replace that number. So at the end of the day, your sample size is not going to be diminished. Your sample size will be 500 as you have specified in the study population or in the sample size calculation.
Thank you, sir.
Okay, good question. I like questions. If there are questions in the chat, coordinator, you can assist me reading them affected. Okay. Does the cross-sectional study contains affected and unaffected group? The answer is yes, because when you are doing cross-sectional study, let's say your outcome is malaria, you are going to do BS to see if some have malaria and some don't have malaria. So automatically, you are going to get not all of them are affected with malaria. Some will be affected, some they are not affected. So in cross-sectional study, some will be having your outcome and some will not be having your outcome. And the purpose of cross-sectional study is to determine the prevalence, whereby some are going to have it and some don't have it. Are we together? So we proceed, yeah?
Yes, I think I have a little question here.
Okay, just go on.
Yes. During our research, maybe I can say research studies, do all research studies, must we specify the sampling before we proceed? Or maybe there are some research that we must do the sampling after we have done all this research. I don't know, you have collected data and maybe you are coming at the end to conclude about the my sample. According to the research that I was conducting, I got the sample size maybe of 500, but not specifying it area. Is it something like that?
No, actually, when you are doing your research, you have to follow this order, which I'm presenting, okay? So you have to determine your sample size. You have to know the sample size and the sampling procedure. How are you going to sample? How are you going to obtain that sample size, that number that you have specified? It should be specified area. You cannot do a study and you have the numbers, the study population, their numbers, and then you come back and justify your sample size. That is very wrong. You have to determine the sample size and describe how your sample will be attained, how your sample is going to be sampled from the study population or from the general population.
Okay, to be maybe more advantageous, maybe what are the effects of a person not specifying the sample size before conducting a research?
Yeah, when you are doing a research, you need to get a sample size, and to that formula, there are things that you are going to tell. You plug in that formula, including precision and the power. This is very important because the research is science, and the purpose of the research is you want to use a small population of people, which we call a study population, to give you the information that can be used for the entire population. You get my point? You want to use a group of people that has been scientifically determined and scientifically sampled to give you the information as if you have asked the entire population. I want to tell Mama Samia that how likely is going to win for this year election. The simple way or the most correct way could be asking each individuals in Tanzania to ask all Tanzanians, but I cannot do that because I don't have fund. Therefore, I want to determine a sample size. I want to determine a certain number from Tanzanian population and to ask that question. And the response from that group which I have selected should be Tanzanians. But if that sample is not well determined and well sampled, the answers I'm going to provide would be wrong. If I ask most men, for instance, they can give me a different answer compared to if I would have asked all Tanzanians, or if I've asked people in town only, or if I ask people in the village only, or if I ask people who are riding boda boda only, the businessmen people, if I ask students, the answer could be different. So I have to find a population that can represent the entire Tanzanian. So if you misbehave on that one, your findings are not going to be generalizable to the entire population. That is the bad thing about sample size. You have to make a sample size that your findings now could be the same as if you have asked the entire population. And that is what we call generalization. Does it make sense?
Yes. Thank you.
Okay, karibu sana. Go back one slide. Go back one slide. I want to know if this is the next one. Okay, so next slide, 5. So after knowing your sample size and the sampling, now you have to narrate the study variables. Study variables, and there are 2 study variables. One is independent variables, or we call explanatory variables, and the other one is dependent variable, or simply the outcome variables. The outcome is what are you intended to measure. For instance, in the example I've given you about alcohol taking and cigarettes and alcohol taking and liver cirrhosis. So the outcome, which is the dependent variable, is the disease. That's the liver cirrhosis. And the explanatory variable in that scenario is the alcohol taking. So you can have several independent variables. You can have like alcohol taking, you can have cigarette smoking, you can have social demographic data can also be the independent variable, age, sex or gender, marital status, and other things. Those can be the explanatory variable. And your dependent variable, the outcome, is in most cases the disease that you are looking for. So the independent variable can also be the clinical data, whereby you do physical examination and you get the clinical data, or it can be laboratory data. And for the outcome, you can have like primary outcome and secondary outcome. Like you can have patients with the liver cirrhosis. So that is your primary outcome. Your primary outcome is liver cirrhosis. And then secondary outcome, for those with the liver cirrhosis, we are followed up after undergoing either operation or a particular medication, and you want to see the outcome or complication if they have developed. That's what we call secondary outcome. So in your study that you are doing, you have to narrate the variables that you are going to collect, and they are in two groups: independent variables and dependent variables. Questions so far regarding study variables?
Sorry, Prof. There are also questions on the chat box saying, can you explain for me more about ballistic sampling? I have not understood.
This is random sampling, okay? Random sampling. Let's say I want 100 students from medical students at KUHAS, okay? How can I get 100 students from KUHAS? I can say I want MD5 students, okay? MD5, you are 250, I think. They are 250, but I want 100. How can I get that 100? What you can do, you can write, just do anything that is a probability, okay? You can use like papers, okay? Papers, if there are 250 students, then you can write papers with numbers from 1 up to 250. And you put in a box, you shake them, and then you allow students to pick those papers randomly. They pick those papers randomly. And then later you say those who have picked the number 1 up to 100 come forward. The rest, you don't need them. So the way you have selected those 100 is by probability or by random selection. That is it. You are setting people by probability. You can either use dice or even playing cards, yes, no, and then you throw a coin. If it falls on this side, then they are selected. So you can do all those ways to select people, but randomly, by probability.
Additional question on that, Professor.
Okay.
Once you have done that, you have done the sampling by random selection. Can't you say that the probability of obtaining a population of the same sex or of the age which is very closely related compared to what you want to get more, to explore? Because if it's 100, you can get maybe 70 boys and 30 girls, but you have to have maybe the same number, 50 girls and the boys are 50.
Perfect. Now it depends on your research. If you want to have the same number of gender, okay, the way you can do. But normally when you are doing random sampling, your sample size selected randomly will be having the gender representation as it is in the general population if you do random selection. For instance, at Cohas, men and female, it is not 50-50 at Cohas. There are more boys than girls, okay? It's like 40-60. There are more men than women. That is at Cohas. And I hope it is the same in all medical schools. So even if you do random sampling, you are going to get that one. Even your selected population will be having that ratio. But it might be you want, as you have said, I want 50-50. So what you can do is you call men and you write numbers. If they say now there are 300 men, you write number 1 up to 300. Those who have picked the number 1 up to 50, they have been selected. Or you can have a pool of 300 papers and you have one that you put a dot, the other one you put nothing, okay? And then the papers with the dots are 50, the number that you want, and then you throw them. So you can say those who have papers with the dot and you know they are 50, but they have been selected randomly. They remain behind and they have been selected. And you do that for girls who are 200 now, but you do the same. You put 200 papers, 50 with the dot, and you allow them to pick. And then you say, those who have the papers with the dots remain behind. You have them and you have selected them. So you have 50 girls and 50 boys. So you have selected randomly after you have done what we call convenience. Convenience. You want 50, you have decided to have 50 and this group 50. So it's a combination of probability and convenience.
Thank you, Professor.
Okay. So regarding study variables.
So there is also one question here.
There are questions on the chat. You can assist me reading. Okay.
Could you please repeat about dependency and independent variable?
Okay. So dependent variable is your outcome. Is your outcome. You do a study. What do you want to determine? I want to determine prevalence of malaria. My outcome is malaria. Okay. So malaria is dependent variable. That is the outcome I'm looking for. And then I want to determine factors associated with malaria. What is associated with my outcome? It could be sex, use of mosquito nets. It could be age. It could be general cleanliness of your house. So those are the factors that are associated with your outcome. They are explanatory variable. They explain the occurrence of my outcome. That is called independent variable. So in most studies, dependent variable is either 1, in most cases is 1 or 2. But independent variables are so many. And these are the factors that are associated with your outcome. Is that clear or still confusing?
So I have also a question here. What is the difference between independent variables and the confound factors?
What the difference between?
Independent variable and confound factors.
And confounders?
Yes.
Okay. Confounders and the independent variable. Simply, they are all independent variables. They are all independent variables. But the confounders, okay, they are the independent variables, or they are factors which they are associated with the other independent factors, as well as the outcome. That is called the confounder. Is a factor that is associated with both independent variable and the outcome. But they are all independent variables. So if you have two independent variables, one independent variable is associated with another independent variable, and that factor is also associated with the outcome, that factor is called a confounder. Until you do some analysis, you might understand this concept very clearly.
There is also
but simply they are all independent variables. But if they associate with one another, that's the way the confounding comes.
Thank you. So there is also a question here from Ida.
So, sir, when it comes to dependent variable, it directly means like you're talking about the title. For example, kama hivyo unataka kuongelea kuhusu malaria. So you have to like, it's supposed to just be one, which is directly associated with what your title of your research says, right?
The independent can be one, but they can be even more. Like in your study, we have seen that gender, being female, is associated with malaria. Not using IT nets is associated with malaria. Living in rural areas is associated with malaria. So you can have several independent variables.
I was asking about the dependent variables.
Dependent variable in most cases is one, malaria.
Okay, thank you.
Okay, perfect. Thank you so much. Dependent in most cases is one. Independent can be more than one. So the independent are these social demographic, the clinical data, laboratory data, and the other thing. And dependent is your outcome. In most cases, the disease that you are studying. Okay,
Sorry,
if that
sir,
is clear,
may I
then
know?
okay, go on.
May I know in what cases can the dependent variable be more than one?
In what cases? It's your discretion. It's up to you. Let's say I'm doing a strict study. I want to determine association between cigarette smoking and cancer, lung cancer. And I'll only analyze that. So in that case, my outcome is lung cancer, which is the dependent variable, lung cancer, the disease. And the factor I'm studying is cigarette smoking. So in this study, I have only one independent variable, cigarette smoking, which is explaining the occurrence of dependent variable, that is lung cancer. So it's up to you, the researcher, you decide either I have one or two or more.
Thank you.
Yeah, but higher studies, they have to be well controlled. They can have that one independent and one dependent. But these studies we are doing, the cross-section studies, you have several of them because they are not controlled.
Thank you, sir.
Okay. So after having known your study variables that you are going to collect, then you have to narrate on how data collection will be done, how the data are going to be collected. Like I'm going to determine if these children have malaria. This malaria will be determined by drawing blood, by prickle, and smear it into the slide, and then use microscopy to determine the BS positivity. Or we are going to draw blood and put it in a rapid test, MRDT, to determine malaria positivity. You have to narrate how data is collected. That is for dependent variable, the outcome. But for other factors like age, sex, we are going to use questionnaire to collect data. Questionnaire to collect that by asking people, what is your age, your gender, where are you coming from? So I'm using questionnaire to collect data. Or I can use patient files. I don't see the patient, but I go to their files and try to extract that information from the file. I get age, I get gender, I get the place where somebody is living, I can get the marital status, I can get all the things. Even for the BS, if I'm not doing the lab things, I'm doing a study whereby data has already been collected, I can go to the file and look at the BS status, was it positive or negative. So you have to narrate all of your variables. Weight, for instance, you have to tell how weight is going to be determined. You have to narrate. We are going to use a weighing machine to determine weight. After putting the patient on the weighing machine, that is called this and this, made from Japan or China, and we address the patient to remove the heavy clothes. How all of your variables are going to be collected to get them. Where are you going to get them? Either by asking or you test. That is data collection. Questionnaire. In the lab, we narrate the procedure. If clinical examination, you say the swelling size is measured by ruler or by tape measure or by handshaking. Fluidity of the swelling, those things. You have to narrate how are you going to collect the data. Measure and collect. Is that clear? Data collection after knowing your variable. So for each variable you have narrated, you have to specify how are you going to collect that information. Okay. Next slide, if there are no questions. Then you have to narrate on data management and statistical analysis. Those are two terms. Data management. How are you going to manage your data? You have your data from the files. You have your data from patients, from questionnaire. You can also have data from another database. How are you going to manage that data? This is about how data will be captured. We are going to capture HIV status, not as positive or negative, because people might know we are exposing their status. So we are going to capture HIV status in 1 and 2. We are going to use 1 and 2. 1 for positive and 2 for negative. We even discourage using 1 and 0 for disease status, because if you say HIV 1 and HIV 0, most people know HIV 0 is not affected, HIV 1 is positive. But if HIV status 1 and 2, then people will not know what status is this one. So data will be captured. How data is going to be captured? Handled after putting that data. This one is HIV positive, gender is this one. How do you handle it? From the questionnaire to the Excel to the computer or to a logbook. So from questionnaire, then we transfer data to the logbook, to the computer by using Excel, or we put it in Kobo, if you know Kobo, or we can put it in Excel from a computer or SPSS, just as a means of storing the data. And then data will be stored in a computer with a password, and that password will be accessible only to the PI and the key investigators. Not anyone can be having access to that data. We are going to collect data anonymized, no names to the data set, so no one can know who is who into that database. And that database will be accessible to only PI and the key researchers. So that's about data management, how data is going to be handled, its safety, accessibility, and the anonymization. Data should be anonymized. And then after that, you do statistical data analysis. So data analysis now, you have to narrate. We are going to do analysis to determine either association, or we are determining prevalence, how prevalence is going to determine which variable will be the denominator, which one will be the numerator, and how statistical analysis will be done. And then how are you going to interpret that association, and which statistical software you're going to use for analysis, whether Stata or SPSS. Now this one is for data analysis. And data analysis is important to be written as per objectives, or per research questions, or per hypothesis. Here in data analysis, you are saying I'm going to use either Pearson chi-square, Fisher's exact test, logistic regression, and other kind of analysis. And significance level will be set at p-value less than 0.05, those kind of things. So we have data management about that, how data is handled, safety, and after you have been collected. Yes, I've known your weight is 5 kilograms. Where do I put it? I put it in a logbook, I put it in a questionnaire. Then from the questionnaire, I put it into my computer in the Excel, or I use COBOL, or I can use my phone and transfer it directly to the database. That is what, or you can use MinTab. Whatever you can use, you have to narrate it clearly. In data analysis is now you're determining your either prevalence, incidence, association, in the state whether it is significant or not, and make a conclusion. So those are the key things in data management and statistical analysis. Questions so far or comments? Then if there are no questions, the last very simple, that is ethical clearance. You have to narrate how are you going to obtain the ethical clearance. How are you going to get the ethical clearance? Normally, you have to present your work to the ethical committee and you have to show the permission number. There are some proposals, they want you to have the permission before you apply for fund, but some you have just to narrate that for this study, we are going to ask for the ethical clearance before we start collecting the data. And ethical clearance is to see that your study is ethically sound for you to do it, but also narrate on how you're going to get permission. Permission is you want to do a study at KUHAS to interview medical student. You have to get the permission from the authority. You have to go to the KUHAS VC or KUHAS Director of Research to ask for the permission for you to go to the students to do your study that has been proved to be ethically right. You want to do a study at Muhimbili National Hospital. You have to ask for permission for ethical clearance, and then you have to go to the director of Muhimbili National Hospital to ask for permission. So permission is obtained from the administrators, but the ethical clearance is obtained from the ethical committee of those institutions. Those are two different things: ethical clearance and permission to do your study. You can have ethical clearance, your study is ethically sound, but no permission. But if your study is not ethically right, you cannot do it. Question so far regarding ethical clearance. This is straightforward, yeah? Then the last one is about dissemination. Next slide. Okay, you have to disseminate your research findings. Here, you have, after you have done your study, you have to narrate on how are you going to give back the information. The findings of your research should be communicated or even disseminated to the participants. Sometimes we are doing studies to a certain area and we collect data. Once we have them, we go home happy that we have completed our study. But those participants, they are not aware. What were their findings? What were the findings for those people when they are enrolled into the study? So you better do, we call dissemination meeting, whereby you invite people who have been participant into your study and you give them the feedback. Or you can either go back to your working station. Once you have done the analysis, you can come back and give them the feedback for the findings. You can give the same information to the authorities, like you did the study at KUHAS, assessing the factors determining either poor attendance to classes. Then you can bring those findings to the authorities, okay, for the study sites where the study was done, or to the stakeholders, to the responsible government bodies like Ministry of Health, or if you did your study in local government, you can do it to DASI and RAS offices, or local government in general. And the other way, the most common way for sharing the findings is through publications and writing policy brief. So you have to specify how your research findings are going to be disseminated at the process of writing a proposal. So as people, they know that once we give you fund, you are going to disseminate the findings. You're not going to stay with them at home or lock them in a cabin, but you are going to disseminate it. This is straightforward. I'll be up for questions or comment regarding this slide. Then thank you so much for your attention. I also can accept any question from the beginning up to the end. Feel free to interact from the first slide to the last slide. This has been an overview and more of a discussion, just to give you interest to read more on methods. So I'll be happy to have comment and any question regarding from beginning up to the end. Karibuni sana.
Okay, we have a question from Daki.
Okay.
Yeah, thank you for this chance. My question was about data management. There are different applications in data management, and during your presentation, I saw you wrote Stata, SPS, Epidata, and some stuffs like those. Now, is there maybe difference in these applications during data management, and also the maybe on how all their significance, maybe what the significance of using Stata rather than SPS, all the significance of using SPS rather than Stata, Epidata, yes, it's like that.
Okay, thank you. Have you ever used them, Epidata and Epinfo?
I've never used them, but I saw during your presentation that there are
Okay,
some.
so Epidata, Epinfo, they are very good for data entry. Data entry. You know data entry, eh? Data entry is you have data now from the questionnaire. You want to enter it into a computer. That's what we call what? Data entry. Though some other people, they can use even Excel for data entry or Access for data entry. But they are not that much good as this specialized tool. For instance, Excel, I know you can enter data through Excel. Huh? Can you use Excel for data entry?
Yes.
Okay. So when you use Excel for data entry, there is a chance you can make some mistakes. But when you are using Epidata or Epinfo or even Access, you can simulate the questionnaire. You can simulate the questionnaire on the screen, and then you enter data as if you are entering the questionnaire, and then they just enter back to the database or to the Excel format of that thing. And the good thing of that is if you have to skip like a question, if somebody has said no from question 1, you have to skip up to question 5. Automatically, the Epidata, after it has been set, it can skip automatically and jump to that question, and you go on putting some of the information. So each tool has its benefits and some weaknesses. So these ones are good for data entry. Epinfo can be used for data entry, but as well as for data analysis, particularly for the simple data analysis. SPSS can be used for analysis as well as for data entry. But we dedicate it more for data analysis. And then Stata is robust for data analysis, and I'm using Stata, but Stata is not good for data entry. You have to use another tool for data entry, and then transfer or import the data from either Excel or Epidata to Stata for analysis. So the key tools for analysis for you can use Epinfo, you can use SPSS, you can use Stata. But the most common tool used in your setup is Stata. Sometimes we are selecting tools to use because there are more people to support you. If you are using, let's say, SAS, no one around can assist you to use that one because they are not familiar. Even some people are using R nowadays, and the population of R is purely command and can also bring you some troubles. But if you are good in command line, you can go with that. Stata is command line as well as you can use it in GUI, we call graphical user interface. So that can be simple, whereby SPSS is mostly GUI, graphical user interface. So it's up to you now to select which one is comfortable with you and look at the people around whom can support. So I know for Kuhas and even for Muhas, most people use Stata, and there are some who are using SPSS, but that population is now disappearing. People are now moving to R. So those are the two parameters, those are two statistical tests to use for data analysis: SPSS, Stata, and R. So choose one to if you're interested, and you can know more than one. For me, I can use with proficiency almost all of them, but I prefer I hope in the data analysis, you are going to use which statistical package for data analysis?
Well, for data analysis, we are going to use Stata.
Oh, you don't know at this moment?
We are going to use Stata. I think our facilitator has a problem with internet connection. Let's wait for him to get back.
Hello?
Okay, yes. I was answering a question about the statistical package which
Hello?
you're going to use.
I'm in.
Yes.
I was disconnected.
Yeah. As you asked me, I was
Mhm.
I was answering on the question you asked me, which statistical package we are going to use in data analysis.
Hello?
So up now we have discussed on
What is the
which
question?
we are going to use Stata for statistical as a statistical package for
Yeah, in the data analysis. Yeah, which data or
sorry,
Stata,
Prof.
eh?
Yeah, we are going to use Stata.
Yeah, Stata is good. And you can learn much about it. So that is good.
Sorry, Prof, we had a problem hearing you. Maybe you can repeat what you are saying a year back, because we had the internet connection. We had a problem with internet connection. You are not audible well. Okay, so hello, Prof.
I saw a question. I was disconnected a bit, but there was a question, which percentage is allowed to be excluded, yeah? Something like that. I remember to
Yes.
see that question.
Yes, what is the
So
percent?
when you are writing your results, what is the percent of?
The question is saying, what is the percentage that is allowed to be excluded from your sample size and still maintain the validity of the study?
Yeah, you should not exclude many people. So when you have finished your data collection, even those whom you are excluded, you just count them. So you are going to make a flow chart. Like in this study, we enrolled, let's say, 1,000. Of these 1,000 pregnant women who were eligible. You know, you can be eligible for the study, but you are excluded, okay? But we are also worrying that the number of excluded people should not be that much. It should not exceed 20%. It should not exceed 20%. Because if you exclude too much, then you are going to have a population that does not represent the study population. So you should not exclude much than 20%. It can bring questions. So you have the exclusion, and then you have you can also have people who you miss some of the information, or they were included perfectly, but they did not respond. They did not return the questionnaire, for instance. That is also critical. And that one should not exceed 10%. We call non-response rate. So don't exclude it too much.
Well, maybe let me ask something. So regarding sample size.
Sample size, okay?
Yeah. There is this thing in data analysis which we must face. Sometimes maybe during data collection, there are some inputs which are not put correctly. Maybe, for example, the age. So we expect the age to be up to 100 in the general population, but someone in doing data collection, maybe he or she put 150, which is the age. So in data collection, we have to exclude someone. We have to exclude that data. So how are we going to prevent this in order to have a better sample for making a conclusion on our side without affecting the validity?
Yeah, there are several ways. Now we prefer to have clean data. That should be our goal. Once you have your data, make sure your data that you are collected is authenticity, is clean, and it tells what's supposed to be told. Like age should be, let's say the age of a medical student should be somewhere, isn't it? 2018 up to 30 if they are coming from work, even 40. We don't expect MD1 up to MD5 is 50 years. Okay? So be very keen when you are collecting data. At that day you have collected data, there should be a supervisor who is going through the questionnaire to see if the data, the way they have been collected, they tell what is supposed to be told. That is number one. There should be someone cross-checking the data, okay? And then have the name of the data collector. If I'm the supervisor, I have the name of this questionnaire. So the questionnaire must have the name of who has collected the data. You see? Then, if I see some funny, some age that I cannot trust, I need to call you. And tomorrow you have to go back to that client so as you can clarify that data. That is number one you can do. Collect data well, collect the name and phone of the data collector for ease of collecting. Even you can have the phone number of the patient who has been interviewed. So as I'm the supervisor, I ask the data collector. The data collector has the phone number of the person whom data has been collected. And then you can cross-check, or you can even ask again to cross-check age, gender, and other things. Number two, there are tools you can use. You specify, like in this field where we are filling age should not be less than 20 years, and age should not be more than, let's say, 50 years or more than 100. You can put that restriction. So when somebody is filling 150, the computer will make noises like doom, 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 doom. And then you know that the figures I'm plugging in is not correct. If you have done that, even in the online forms or whatever, if you fill in the information that is not required, you see the computer making noises or is producing an alarm. So you know that this what I'm filling in is wrong. So you can look at that. Like disease outcome, it can be 1 and 2, or gender 0 and 1. So you can put that pin. Anything beyond 0 and 1 should not be put in. If you do that, the computer will make noises. And then the one who is filling it can know that now I'm putting something that is not supposed to be there. So that's the advantage of using those tools, Epidata and the other tools. For even REDCap can do that, so that you know the data I'm collecting is correct. And you minimize those. The other thing, after doing that, you can do imputation. Imputation is whereby you try to do some algorithm to try to fix that number by using statistical approaches. And that can be done. The other thing is to remove them, but they should not be so many. Some people, they prefer to remove them from the database. If they are not much, you can do that.
Well, thank you for the answer. I want to say to maybe if there is other question from participants, you're free to ask now before we end up the session. So maybe my last question is about calculation of the sample size. They're saying sometimes if we don't have, they're saying sometimes if we don't have there's this formula we use, I forgot the name, whereby we use the prevalence. So in case, if I'm studying about something and it's difficult to get a prevalence of that particular topic, what should I do on that part?
If,
for example, I'm studying maybe there is a rare disease which I'm about to start, and in order to get my sample, I have to use the prevalence of that disease. So what thing can I do to such study, for example, a rare disease, which is difficult to get a prevalence from other studies which have been published, which are concerning my research topic? Which text can I use?
If you don't have the study to plug in the prevalence, we are advising you to use 50% as the prevalence. You use 50% as prevalence if you have no study that has determined prevalence elsewhere. There is no study for that. So plug in P is equal to 50%.
Okay, thank you. And
yeah.
Also, what about they are saying even sometimes we as investigator we can just assume or maybe select a certain sample size for a study. Maybe we, for example, I want to study on viral suppression in HIV patients. So, and I know it is difficult to get the sample size, or maybe, for example, what can I say? There are some situations in which I can't predict whether I will get the sample size and the required sample size because the disease is rare. So maybe I can what other technique, because they're saying I can just say maybe I will get the sample size from what I get. For example, yani kwamba sitaangaika na sample size kukalkulate, bali nitaenda kuchukua watu waliopo nitawapata, ndo hao nitawafanyia conclusion ya study yangu mwishoni. Hapo inakuwaje? Sorry, Prof. I can't hear you.
It can be a poor study, and it be just a case series. A case series whereby you have just collected cases and you study them. What you are getting cannot represent the entire population, but can just give some information. Remember, the purpose of doing statistics is to have the parameters that can be generalized to the entire population. That's the very key of doing research, and that's the scientific part of the research. We must have a certain sample size that the findings we get from that sample size can represent the entire population. If you miss that, then it is not a scientific study. It is just a case series which has poor evidence, but we can use it as an eye-opener just to tell us. So it is very important to have the sample size. And if the disease you are saying is rare, so being rare, it means you have the prevalence. The prevalence is rare. So it is a certain number that is very small. You have it. But if there are no studies at all, we are saying put 50%. So as your study is robust and your findings can be generalizable, have meaning to the population. You cannot say, people don't like Mama Samia, and for you, you have just asked the two people. You have just asked the two people. You are saying, those are the ones who were there. Fine,
Yeah.
people don't like her, but that cannot be taken as the conclusion from the entire country. You need to have a good sample size and how to sample that one. Either certain number from all regions in Tanzania, represent gender, represent age, represent cadre, represent rural or town, represent students and business people, farmers and whatever. Then once you have your conclusion, you can say, wow, this can be representing the entire country. But don't say, it was very hard to get people. I can't find these 10 people and I have asked them, they told me this is the situation. Fine, you can be just an observer, good observation, eye opener, but not generalizable to the entire population.
Thank you. So there is also another question from Daki. Please come up.
Okay, thank you for this chance. My question is simply from the exclusion and the inclusion criteria with this collaboration with the time for the research. That my research, maybe I'll conduct from January to December. Now, I have a sample size of 500 people that I'm going to conduct a research on them. Now, during that area, you specify that my research, I'll start from January to December. And from those 500 people, maybe I started from the first person to maybe I reached the 15th person. Then I found that this person has a certain exclusion criteria. Now, will it not affect the study duration of my research? Because just excluding someone who was part of the research, will it not extend the study duration, or how can I compensate the time that is required for me to complete the appropriate research that I'm conducting? That's my question.
Yeah, but normally they are, what you are going okay, it does not mean that there are only 500 people into that region. You get me? In actual sense, there are more than 500. So sampling is how do you get that 500? So if I can get one, is it to get them? They are there. You see? So you can put that one and then exclude it, but does not affect your procedure because you have so many people. And that is the essence of sampling. We are doing sampling when there are so many people, but we want some of them. The question is, how do you get those few? So you have to do sampling, and because you have so many participants, that will not affect your time duration.
So so the major thing here is selecting a large population, then choosing a few representatives.
Yeah, so your sample size should be smaller than the study population that is available.
Okay, I understand you.
You get the concept?
Yes, I get the concept. Thank you.
So I think there's no other question, even in the chat box.
Okay.
So maybe let me take the time to say thank you for teaching us today. We appreciate your time, and what we have learned today is a lot, and we would like to get more session from you in the future. And maybe if there are students here who want to get mentorship from you, even ask you something later. So if you can help us get the email for contact in the future.
Okay, you have my email. Let me type it to you. Yeah, I can type here in chat, and then you can send me anything at any time. I'm glad that you have enjoyed the session, but this is just an eye opener. benkidenya@gmail.com. So I've pasted it, benkidenya@gmail.com. So this is an eye opener, and I believe that you have done this kind of trainings in epidemiology and elsewhere. The good thing of mastering these things is to do them. Otherwise, you are going to attend several trainings. Each time they keep you training, they keep you teaching you, but do it and then make it be your routine. If you have been doing data analysis, do it. Once you do that, you are going to master it automatically. So what you have done today is just to incite, is just to give you an impetus, an interest, so as you can stand on your own and you can start reading and studying. There are so many things to read on internet, even in YouTube. So get informed, be informed, and acquaint yourself with those kind of trainings. Should you have any question at any time, don't hesitate to ask me. You can email, you can drop your email in my email that I've shared with you. You can come to my office for those who are around Cohas, and let us keep on discussing. I'll be glad to have you in the next session. teaching anything, okay? But make it be your culture, your custom to study, and make these things to be on your hands-on skills. Thank you so much for your time and for having me in this session.
Well, thank you too. So this marks our end of the session. So till tomorrow, where we shall have a session of data analysis at the same time, 6 o'clock p.m. And as we discussed, please come with your laptop, and you have to install Starter on your laptop, so as during session we're gonna have a session will be a participatory, since we shall be giving you assignments for you to do, because data analysis need practice, and without practice everything you learned will be erased in the memory. So come with the laptops, so the Starter, so as we can go on. So thank you, profs.
Yeah. Okay,
See you
thank you and bye.
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 Okay, good night, Prof.
Thank you. Good night to you too.